How Trump's new law impacts ACA and Medicaid in non-expansion states. Even in states that resisted the Affordable Care Act, the new legislation from Trump carries serious health implications. August 5th, 2025, 5 a.m. EDT, Health News. Millions may experience an increase in health insurance premiums. Miami. Republican legislators in 10 states that have consistently opted out of the Affordable Care Act's ACA, Medicaid expansion argue that their conservative strategy concerning government programs will yield long-term savings. However, the budget law passed by the Republicans, incorporating numerous priorities of President Trump, is poised to impose a burden on both patients and hospitals in these states that is comparable to the consequences faced by the 40 states that have chosen to expand Medicaid coverage for low-income adults. Warn health leaders and hospital officials. Take Georgia, for example. With a population exceeding 11 million, it is projected to see a similar number of individuals losing health insurance via ACA marketplace plans as California, which boasts a population more than 3 times that of Georgia, according to forecasts by KFF, a respected health information nonprofit that includes KFF Health News. The newly enacted law introduces intensified paperwork requirements for people enrolled in Obamacare, significantly reduces the annual duration for signups, and cuts funding for navigators who assist enrollees in comparing and selecting insurance plans. These shifts are anticipated to particularly diminish enrollment in states like Florida and Texas more drastically than in California, due to the larger share of residents in non-expansion states who depend on ACA plans. Dubbed the One Big Beautiful Bill by Republicans, this budget legislation is set to catalyze drastic changes across the nation's healthcare landscape, slashing federal Medicaid spending by over $1 trillion in the coming decade. Medicaid currently supports more than 71 million individuals with low incomes and disabilities, and the Congressional Budget Office estimates that around 10 million people might find themselves without coverage over this same period due to the law's implementation. While many provisions of the law primarily target the 40 states that have embraced Medicaid expansion, its repercussions will extend beyond those boundaries, notably a proposal from conservative factions to curtail the more generous federal subsidies granted to individuals who gained Medicaid coverage through ACA expansion was left out of this legislation. Lawmakers in states that haven't expanded Medicaid should be outraged about this exclusion, stated Michael Cannon, Director of Health Policy Studies at the Cato Institute, a libertarian think tank. The potential for an increase in the number of uninsured individuals in non-expansion states could intensify if enhanced federal subsidies for Obamacare plans are allowed to expire at the year's end. This expiration could lead to skyrocketing premiums as soon as January, exacerbating the uninsured rate. KFF estimates that in just Florida, as many as 2.2 million people might lose their health coverage, a state notorious for denying Medicaid expansion, and that, paradoxically, leads the nation in ACA enrollment. Consider the story of Francoise Cham from Miami, whose current coverage under Obamacare has fundamentally changed her life. The 62-year-old single mother recalls a time when she would give blood simply to afford cholesterol checks, and how she would indulge in an annual wellness exam at Planned Parenthood. With an expected income of around $28,000 this year, she pays approximately $100 monthly for her ACA plan covering both her and her daughter, which significantly strains her financial resources. Cham became emotional as she described the essential safety net that health insurance provides her, especially as she confronts the real possibility of being unable to afford coverage if premiums escalate towards year-end. "Obamacare has been my lifesaver," she shared, illustrating the stark vulnerability many face under the proposed changes. Cindy Van, a health policy specialist at Manat Health and former deputy administrator for the Centers for Medicare/Medicaid Services, warned, if the enhanced ACA subsidies aren't renewed, the fallout will hit everyone hard. However, in states that haven't expanded Medicaid, more marketplace participants are enrolling at lower income brackets, meaning a larger portion of their populations are reliant on the marketplace. Despite potential attempts this year by GOP lawmakers to further cut Medicaid, it seems that the states which opted for Medicaid expansion have made a judicious choice, while those that have resisted face financial pressures without any corresponding benefits. According to insights from health policy experts and hospital industry analysts, KFF Health News has reached out to the governors of the 10 states that have not fully embraced Medicaid expansion, seeking to understand if the latest budget legislation has influenced their stance or opened them up to the concept. However, representatives for Republican governors Henry McMaster of South Carolina and Brian Kemp of Georgia did not indicate any changes in their state's positions concerning Medicaid expansion. Brandon Chirachak, a spokesperson for McMaster's office, emphasized that South Carolina's Medicaid program currently targets low-income children, families, and individuals with disabilities. He added, the state's Medicaid program does not foresee any significant impacts on the agency's Medicaid population. National enrollment in ACA marketplace plans has more than doubled since 2020, now reaching 24.3 million individuals. If the enhanced subsidies were to vanish, average premiums for Obamacare coverage could jump by over 75% based on a KFF analysis. Certain insurers have already hinted at intentions to raise their rates. According to the CBO, permitting enhanced subsidies to end could result in an additional 4.2 million people lacking health insurance by 2034, compared to what would occur if those subsidies were continued indefinitely. This looming loss would compound the insurance coverage declines brought on by Trump's budget law. This development is alarming and troubling for us, remarked Eric Boley, president of the Wyoming Hospital Association. He pointed out that Wyoming's modest population and the lack of appeal for insurance providers have resulted in few companies offering plans on the ACA exchange, raising concerns that any uptick in the uninsured rate could destabilize the insurance market in his state. As the numbers of uninsured individuals rise in non-expansion states and the impending Medicaid cuts from the budget law become apparent, lawmakers have indicated that state funding will not be sufficient to make up for the decrease in federal dollars, even in states that have rejected Medicaid expansion. While slightly better terms were applied to these states under the law, it's still inadequate, as indicated by Grace Hogue, spokesperson for Kansas Governor Laura Kelly, who advocates for Medicaid expansion but has faced resistance from Republican legislators. The ability of Kansans to access affordable health care is going to suffer, Hogue expressed in an email, underscoring the gravity of the situation. For hospital leaders in states that chose not to fully expand Medicaid, the budget law presents yet another challenge by restricting the funding arrangements states have historically relied upon to secure higher Medicaid reimbursements for healthcare providers. Starting in 2028, the law will begin reducing these payments by 10 percentage points annually, aiming to align them more closely with Medicare payments. Richard Roberson, president of the Mississippi Hospital Association, emphasized how this year the state's directed payments significantly boosted Medicaid reimbursement rates from $500 million to $1.5 billion, vital for sustaining rural hospitals. That payment program has been a lifeline, he asserted. The budget legislation does include a $50 billion fund intended to protect rural hospitals and clinics from the changes introduced for Medicaid and the ACA. However, a KFF analysis found that this fund would only offset roughly 1/3 of the anticipated Medicaid cuts in rural communities. During his first term, Trump encouraged states like Florida, Tennessee, and Texas to continue rebuffing Medicaid expansion, granting them an unusual 10-year extension for what are known as uncompensated care pools, financial mechanisms that funnel billions to hospitals for care provided to uninsured patients, as described by Allison Orris, Director of Medicaid Policy at the Center on Budget and Policy Priorities, a left-leaning think tank. It was clearly a strategic move by the Trump administration to offer substantial financial incentives for these states to avoid expanding Medicaid, Orris pointed out. Although these funds remain unaffected by Trump's recent tax and spending law, they do not offer the same benefits to patients as actual health coverage would. It's funding hospitals, but it does not directly address patients' health needs, explained Orris. It doesn't offer preventive care. States like Florida, Georgia, and Mississippi have not only turned down the additional federal funding from Medicaid expansion, but many of the remaining non-expansion states allocate less per Medicaid enrollee compared to the national average, offer fewer or less comprehensive benefits, and cover a narrower range of low-income individuals. Mary Mayhew, president of the Florida Hospital Association, criticized the state's Medicaid program for failing to sufficiently cover children, seniors, and disabled individuals due to low reimbursement rates. Children struggle to secure prompt dental care, she noted. Expectant mothers lack accessible OB/GYN services, resulting in the closure of labor and delivery units across Florida. She warned that in the long term, this law will financially burden states further. The healthcare outcomes for the populations we serve will decline, leading to elevated costs, increased spending, and greater dependency on emergency services. KFF Health News serves as a national newsroom dedicated to producing comprehensive journalism on health-related matters, and is one of the main operational programs of KFF, a recognized independent source for research, polling, and reporting on health policy. Urgent. Blue Shield of California 25-plus health groups demand Congress extend ACO tax credits. In a significant move, Blue Shield of California has allied with over 25 prominent national health organizations to advocate for the continuation of tax credits under the Affordable Care Act, ACA. This initiative aims to safeguard health insurance for individuals and families across the nation. As of August 5th, 2025, the Affordable Care Act has successfully broadened access to affordable health insurance for millions of Americans. California stands out as a prime example, having transformed from a state with one of the highest uninsured rates to one of the lowest, thanks to the reforms introduced by the ACA. In light of these developments, Blue Shield of California has joined forces with a coalition that includes notable entities such as the American Medical Association, the National Urban League, and the American Cancer Society. Together, they have penned a letter directed at Congress emphasizing the dire consequences that would arise if the expanded ACA tax credits were to lapse at the end of 2025. The letter begins with a stark warning. Over 20 million Americans face the threat of a cost of living crisis that only Congress can avert. It further elaborates, stating, these tax credits significantly reduce the monthly premiums for individuals purchasing insurance through state and federal marketplaces. Should Congress neglect to extend these credits, the financial burden of health insurance will skyrocket, compelling average American families to pay hundreds or even thousands of dollars more each month to maintain their current coverage. Key, in California specifically, The Kaiser Family Foundation has projected that approximately 250,000 individuals currently enrolled in the ACA marketplace could lose their insurance stemming from the recent legislation known as the One Big Beautiful Bill. This legislation imposes additional restrictions on eligibility assessments, re-enrollment processes, and coverage for immigrant populations. However, if the expanded ACA tax credits are allowed to expire, this number of uninsured individuals could surge to over 400,000. For those interested in the full details, the complete letter to Congress can be accessed here at https://getfile/x/x/pdf file/1xplacex.